When it comes to fighting COVID-19, how does an Indian communist-run state match up against the United States? Pretty well, actually. India's first case of coronavirus was reported in Kerala, and the state moved quickly to flatten the curve. We're going to look at how Kerala's communist-led government rose to the challenge, and whether the US and the rest of India can learn from it. First, let's take a look at Kerala. It's a coastal state in southwest India with a population similar to that of New York, Georgia, and Alabama combined. Kerala's GDP per capita is below $2,000. That is far less than $62,886, which is the US's GDP per capita. And yet, as the US reached 100,000 COVID-related deaths by the end of May, Kerala had 7. How is that even possible?
There is a sense of unity. There's a sense of preparedness. There's a sense of, hey, we have done this before, we can do it again.
Meet Dr. Aju Matthew. He's a doctor in Kochi in Kerala. Kerala's success kind of comes down to two things: its strategy and its political infrastructure, which we'll get into in a bit. This is Kerala's teacher-turned-health minister, KK Shailaja, aka the Corona Slayer. Shailaja heard about a dangerous new virus spreading in China in January. So what did she do? She assembled a rapid response team, and Kerala adopted the trace, test, and treat protocol before it even got its first coronavirus case. Then, on January 27, Kerala confirmed its first case from a student flying in from Wuhan. The state mobilized an army of testers, as seen here on government-issued footage. A test produced results within 48 hours. And Kerala's strong community leaders allowed extensive tracing. By April 11th, 401 tests per million had been taken.
Kerala uses a socialist model of governance. The decision-making trickles down to the lowest level of the population, from the village up.
This is Dr. Shahid Jamil. He is one of the leading virologists in India.
So Kerala did very well in just reducing the stigma very early on and let communities take care of people within the community. Essentially let the public health care system involve communities, which is now we are learning very, very important.
There's also been careful and creative messaging, like this ad. While in the US, this was happening.
This great country of ours, we have 240 cases. Most of those people are going to be fine.
The government of Kerala launched the Break the Chain campaign. Dancing police officers and robots informed citizens of hand hygiene.
The administration's messaging that you should ensure physical distancing, but the social cohesiveness should be intact. We have framed exceptional campaigns.
Even compared to the rest of India, Kerala was several steps ahead. The state eased into lockdown weeks before the rest of India followed suit in mid-March. And when Indian Prime Minister Narendra Modi did announce a strict lockdown, he did so with just 4 hours' notice. This forced hundreds of thousands of migrant workers to walk hundreds of miles back to their homes, facing hunger and death during the lockdown. Now, compare that to Kerala, where workers were given shelter and food, and later sent back home in trains.
I think there are a couple of other factors that needs to be brought into picture, and that is the incredible spirit of volunteerism.
At the same time, Kerala had a public distribution system. It meant people were given ration cards for free food kits. Oh, and Kerala also set up hotlines where people could call in if quarantine was impacting their mental health.
There are updates given regularly, and the emphasis is on providing a safety net. I strongly believe that lockdown without safety net is torture.
The important thing to note is that Kerala's effective response to COVID-19 didn't come out of nowhere. It's got a lot to do with its political system. For decades, Kerala's communists have been regularly voted into power. They and other left-wing governments have invested heavily in education and healthcare. For example, while Kerala spent 6.5% of its state GDP on healthcare, the whole of India spent just over 1% of its GDP on public health. Oh, and by the way, the state also has one of the lowest rates of poverty in India.
This cannot be built in a few months. It requires decades of empowering communities, empowering people, the population with literacy.
The state also has the highest literacy rate in India at 94%. High literacy means people knew which sources of information to trust.
There is no Kerala model without high literacy. I think there is a very good scientifically inclined population in Kerala who are willing to listen to the administration.
In the US, there seemed to be a disconnect between what the president was saying and what leading health officials were saying.
The most important thing that anyone anywhere can learn is that the messaging has to be absolutely clear. It doesn't help when the public health expert is saying one thing and the leader of the country standing right by him is saying something else.
And then there's learning from history. The state's preparedness comes partly from dealing with the Nipah virus outbreak in 2018. But remember, Kerala is technically a communist-led state that still struggles economically.
Can we have an amazing public health infrastructure, a well-empowered, decentralized politics, government, administration, and a flourishing economy that requires complete freedom from licenses? It's a fine balance.
But still, the rest of India could learn something from Kerala. The country is now opening back up despite cases still soaring, overwhelmed hospitals, and low rates of testing. While President Trump suggested injecting disinfectants, cow urine as a treatment was widely circulated among Hindu groups in India. And as Asian Americans in the US faced racist attacks, Indian Muslims were also attacked and blamed for being virus carriers under Modi's Hindu nationalist government.
After asking my name, they said, "You're a Muslim, you've destroyed the country, you've spread coronavirus," and then started beating me with sticks.
So, if the US can't replicate Kerala's political system, the question is,
what's the lesson America can gain from a place like Kerala? I think leadership. A leadership that knows how to follow good science.